I'm Ramon. I'm one of the physical therapists here at this VA facility. I'm going to teach you how to use a wheelchair. Let's begin. Number one is safety. So the most important thing in wheelchair instruction is how to lock the brakes. So make sure the brakes are locked. So push it backward, that unlocks it. Push it forward, then that locks it. So for a patient, you just only need to pull it backwards, that unlocks the wheelchair, and to push it forward to lock it. And make sure again to lock it every time you get in and out of the wheelchair. Okay, that's for the most important part of the wheelchair training, is always the brakes for safety. Okay, next, this is how you fold a wheelchair. Okay, to stow them away. Okay, just pull the seat up. That's the quickest way. Next, another feature of this wheelchair is known as inserting the anti-tip bars. So these are the anti-tip bars. All you need to do is, using a screwdriver, pop this one out. Those are covers for the tube, and then attach the accompanying anti-tip bars or lever. Okay, so insert it until you hear the click. And then insert the right one until you hear the click. Now this comes in handy, so just in case you're going to go up a ramp, or your patient or your relative will suddenly get up from a chair. Sometimes the chair will just tilt backwards, and this will prevent it from tipping backwards. So it comes in really handy when it comes to safety. Let's put this aside, and let's go to the leg rest. So this leg rest here is, we call the elevating one. Okay, which means that anybody who needs support on the legs, you have to use this kind of leg rest. Ask your therapist about it, or the therapist will decide for you. It's the best professional to take care of what you really need in terms of wheelchair use. So swing it inward, lock the lever there, and then that locks it. Now let's begin. So let the patient sit on the wheelchair, and then you can unlock the locking mechanism here for it to adjust the length of the leg rest in according to the length of the legs of the patient or lower extremity. Okay, so this is the calf rest, this is the foot rest. So to elevate it, just push the lever forward, and that unlocks it. Then you can adjust the height according to the comfort of the patient or according to his condition. So again, forward to elevate, and then push it. Of course, you have to lower it slowly. Okay, that unlocks it, and that will support the leg. Let's come to the most typical leg rest, which is the standard. So yank the lever here, find the two holes, line it up with the pins, and then swing it inward. That locks it. When the patient's seated, you can again unlock the locking mechanism and adjust the footrest according to the length of the legs of the patient. Again, this is fixed, so there's nothing to adjust. And going back, this is to unhook it. All right. Now, another thing is to get it in and out of the car. It's much lighter if you really remove the leg rest. So remove the leg rest, take it off. Again, I've shown this a while ago. Fold it, and that makes the wheelchair lighter. And getting it out of the car without the leg rest, just in case you slam the wheelchair into the ground, the leg rest is out of the way. You preserve, and the leg rest, like this corner here or the pins, you will preserve it so that it will last you longer. Avoid damaging the wheelchair. All right. I guess I covered everything about the wheelchair. Stay safe, and again, to our beloved veterans, thank you for your service.